I'm Nora Bachman. I'm a pediatric physical therapist in Santa Monica, California. One of the questions I get asked all the time is, what does PT look like with kids? So for those of you who have done PT as an adult, it's usually after an injury and you go in, hopefully your therapist does some manual work, help loosen you up, you do some exercises, you stretch and go home. Most kids I know would not participate in most of that. So when we're looking at PT for kids, it often revolves around what are called gross motor skills, large movements. As a PT, I often will still take a lot of objective measurements, as many as I can with a kiddo. So you may have seen a goniometer, something we use to measure range of motion. I'll try to get some measurements of strength, but a lot of what I'm looking at with kids is functional skills. What can they do? How does whatever deficit they're coming to me with affect their ability to participate with their friends, with their family, in activities that other kids are doing? And that usually revolves around a number of specific skills. One is strength. So the PT that you go to as an adult who has you doing 3 exercises of 10 reps of whatever the exercise isn't normally going to happen with a pediatric patient. It's all around play. So I might still look at my kid's strength and I'm going to dissect their movement pattern. So not only what can they do quantitatively, but qualitatively. What's the quality of their movement? What does it look like? What part of the activity are they having a hard time with? With kids who are slow walkers or just have poor balance and aren't really running, a lot of time I see weakness in the foot and ankle. So the muscle that's on your shin, the front of your shin, that lifts your toes up off the ground and prevents you from tripping. A lot of times that muscle isn't strong enough, or it's just not activating properly with the kiddo. So there are specific games and exercises that we'll do with those kids that feel just like play. Another thing I'm looking at is endurance. How long can a kiddo participate in an activity before they're tired of it because they're cognitively, mentally just bored with it, or they're physically tired, so their body just can't keep up? We'll look at neuromuscular control. So this is the connection between the brain having an idea, sending a signal through our nerves to a muscle to activate it, as well as controlling that motion. So if I tell you to clap, how quickly do you bring your hands together, and can you control what that movement looks like? If you're jumping, especially jumping down from a higher surface, you need to bend at the appropriate joints with a lot of control to avoid injury. If you jump down stiff-legged and you're not controlling it, or your legs just give out, that's how you get injured. We're looking at balance. So not only the ability to stand on one foot, although that is important, but dynamic balance. Can you stand on one foot while doing something else? And coordination. So the ability to catch a ball requires the muscles of the eyes, the brain taking input, the hands responding, and coordinating all of those pieces. So a lot of times when I get a kiddo, they may just have something called developmental delay. They're just not doing the things that their age-matched peers are doing. So I want to look at all of these specific skills, and I want to break down each of them to figure out what's going on and why aren't they being successful, come up with a plan. How can we incorporate skills to address those deficits? And then we got to make it fun. So how can we make it playful to build those skills and really make progress?